This is the lemon bifurcation lesion made in a 1-on-1 with a critical lesion at the proximal circumference and a distal LED diffuse long lesion. And you can find some calcification on the angel, and the patient is female, elderly, more than 80 years old, and her ejection fraction was very poor, less than 30%, and with the recent decompensated pulmonary edema. Then I want to, and maybe the iris could close, but I think we'll do the procedure, we need the mechanical support. So I put on ECMO support, then we use the pre-dilatation 2.5 NC balloon and check the iris. This is the iris image. This iris was, distal circumference was healthy, but to the middle part and the proximal part, there was some non-calcified plaque. Then for left main, diffuse long lesion, LAD diffuse long lesion, and near the LAD ostium, you can see that there was the eccentric calcium, not the ring calcification. That means we don't need to do the departing procedure. So I will use, don't need the iris, the vessel size, we do the 3.0 NC balloon pre-dilatation, and we use the DCB 3.0, and you know the DCB for the ostium of circumference, it occluded the LAD flow also. You can see the LAD no flow, and you want to maintain 60 milliseconds. So that is the function for the ECMO support. Even with the ECMO, the patient blood pressure is from the 110 drop to the 70, but after we deflate, the patient recover well. Then we do the provisional stenting with the KBT and the final port. Then we check the iris. I see that was fully open, some dissection with some hematoma. And this is from already pulled back from the distal part. You can see the stem open, quite acceptable to the main ostium. This is the final angio. Sorry. You can see some dissection over the proximal circumference, but the flow was not limited. So we decided to let it be and clinical follow-up. The patient winning ECMO right after the PCI, and she discharged 3 days later, recovered well, and she has no more symptoms for a recent 2 months. And this is my last slide. And for lemon bifurcation, the lemon bifurcation is not like the other bifurcation. Lemon bifurcation is unique. Generally, the provisional stenting strategy might be better than 2-stent strategy. However, for a larger side branch or the longer lesion length, the 2-stent strategy might be better. And to utilize the DCB for side branch will be better than the angioplasty only. And I think the hybrid DCB strategy might be bring better outcome comparing with the traditional 2-stent and provisional stent procedures. But we need more data to convince everyone. Thank you for listening.
Okay, thanks.